Hello, everybody. My name is Jeff Costello. Welcome to our webinar today. Today, we're going to be learning the ABCs and Ds of Medicare. We're going to try to have you out in anywhere from 20 to 30 minutes, and it's just going to be dependent on how excited Mike and I get on Medicare. So we hope you're excited, and we're going to dive in. So when it comes to Medicare, this is probably how you feel. Right? You're confused. You have Joe Namath on TV, all these celebrities talking about, what you should be doing for Medicare. Your mailbox is full, and it can be overwhelming and confusing. So we're hoping that today is going to relieve you with all that stress. And if you actually stay until the end, what we're going to be giving you is our PDF. It's our booklet on the guide to Medicare. So it's going to kind of go over everything that we're going to be talking about today. So don't feel pressured to take notes or anything like that. Everything that we're going to be talking about today, we're going to give you to you in a PDF format, so you can be confident with your enrollment into Medicare. So as I mentioned before, my name is Jeff Costello. I'm a financial advisor. I've been doing this for over a decade. We've taught numerous seminars and webinars on Medicare and other insurance and financial topics to people, whether it's in person or virtual like we are here today. I've been dealing with Medicare, the ABCs and Ds, and because I have 3 kids, I'm also pretty proficient in the normal ABCs and Ds. So we're going to try to make Medicare as simple as possible on today's call. So simple as if I was teaching the ABCs and Ds to my children. The other person on our call today is Michael Multulo, who is an insurance broker. He's been doing this for close to 6 to 7 years now. He's also in New Jersey with myself. So we're going to dive in. I'm going to turn the ball over now to Mike.
Yeah, thank you, Jeff. Thank you for the introduction. I am a New Jersey resident. I grew up in Hunterdon County. I went to school at Rowan University in South Jersey, and I now reside in Lavallette, New Jersey. So I travel all over the state, helping friends and family and anyone turning 65, employees of some of our business group clients. And I'm excited to get started today and talk to you guys about Medicare and how we can ease you through the enrollment process. So let's talk about the agenda and the items that we're going to cover. We're going to talk about Medicare, give you a brief history of what it is, how it got started. We're then going to discuss how and when to sign up. What if I'm still working? When do I become eligible? We're going to talk about what is Medicare Part A, what does it cover? What is the difference? What is Part B? What does that cover? Also, what is not covered by Medicare? Do I need to get individual dental and vision? Is that covered in a supplement plan? We're going to go through what the supplement plans do cover. Then we're going to talk about Part D, prescription coverage. We're also going to compare your options in what is Medicare Advantage, what are those plans, what is the Medigap plan, otherwise known as a supplement offering. And then we're going to have a Q&A session, answer any questions that you may have. And then if you'd like to move forward and engage us and see if we can help you through this process, we're going to discuss the next steps that you can take to move forward. So Medicare began in 1965. President Lyndon B. Johnson signed it as an amendment into our Social Security legislation. What it does is it's basically health insurance for people aged 65 and older. And it's also available to some people who meet special criteria. They might have a disability. One example is end-stage renal disease. So, it's a program that offers coverage for those who are 65 and older specifically. Okay, so when do you first become eligible to sign up? That's going to be 3 months before your birth month. And all plans enroll on the 1st of the month. So whether you're born on the 3rd, the 19th, the 26th, your enrollment date is going to be the first of your birth month. And what you want to do in terms of signing up is get onto the Social Security website, create yourself a profile, and enroll at that time, 3 months prior to your birth date, so that it gives the government offices enough time to produce your ID card, because you're going to need that Medicare number to do anything else. That's enrolling is going to be the first step. Okay, what also do you need to know if you're still working? A lot of people are working into their later years just because you're eligible for 65 and maybe you want to keep working. What are the rules there? So if you work for an employer that has less than 20 employees, it's mandatory that you sign up for Medicare because that's not considered credible coverage. Now, that also includes people who have individual medical plans, right? If you purchase your insurance through the marketplace, that coverage is not going to be paid for. If you have a claim, you must sign up for Medicare Parts A and B. What if you work at an employer with more than 20 employees? Well, you can retain that insurance and remain on the group plan. Maybe they're paying 100% of the premium, but you should also sign up for Part A because that covers anything. It's secondary coverage. When you work at an employer that has more than 20 employees, that insurance can remain primary. But there is one thing to remember: if you do sign up for Part A, you can no longer contribute to HSA plans. So if your employer with more than 20 employees offers an HSA plan to you, you cannot contribute to that savings account any longer. Part A. This is going to cover your hospitalization, inpatient psychiatric care, skilled nursing facility care. We're not talking about long-term care and the assisted living situation. That doesn't pay claim benefits for that. But this is more like home health care. If someone needs to come in and assist you with maybe bathing, or you need to be given your prescription medication, that you need to use the bathroom, it's going to pay for those type of claims. And how is it paid? You're going to be responsible for some co-payments. There may also be co-insurance charges. And that's why later on in the presentation, we're going to want to talk about pairing, a supplement plan with just Medicare, because Medicare doesn't cover everything. There is going to be some level of responsibility in terms of what's billed to you. Days 1 through 6, you're going to be responsible for a $1,600 deductible. Days 1 through 60, I apologize, you're going to be responsible for a $1,600 deductible. And then days 61 through 90 is a per day co-payment. That's $400 per day. And then days 91 through 150 is $800 per reserve day. Anything beyond that, you're responsible for all of the costs. Part B is going to be your medical expenses, where you see primary care physicians, you see internal medicine doctors, specialists. It's also going to cover a lot of your laboratory requirements. This is basically your preventative care. You go to these types of doctors to ensure that you don't end up in the hospital all stay. We want to be preemptive with our care. We want to make sure we do our annual checkups and get blood labs to make sure that if there's anything that needs to be attended to, we do, to make sure that we're healthy. This is where you would, there's an annual deductible. You're responsible for $226 in 2023. That was reduced from last year's number. The government offices gave us some relief. And then after that deductible is met, the member is responsible for 20% of the charges. Medicare pays 80%, but there's no maximum out of pocket. Okay, so what are the premiums? Well, it's interesting because the premiums are determined by your income in years past. So if you made above $194,000 as a married couple filing jointly, you're going to pay a tax, if you will. It's going to be a increase in the premium. If you earned less than $194,000 as a married couple filing jointly, or $97,000 as an individual, you're going to pay $164.90 per month. If you have not yet elected Social Security, though, you're going to receive a quarterly bill. So this also ties into Social Security planning. We have a lot of other webinars to address the different income levels and associated costs. But if you take a quick look on the screen here, you can find where you fit based on your 2021, and we're going to be coming up on our 2022 tax season, so you can estimate your future premiums when you sign up. What's not covered by parts A and B? Some of these services are long-term care. This is a big one. Routine dental care, whether it's just for regular cleanings or major services, there are no coverages by Medicare for dental work at all. Cosmetic surgery, anything elective is also not covered by Medicare. Hearing aids, as we get older, we might be hard of hearing. There's a lot of programs available for people, but none of this is going to be put through your Medicare for coverage. And then podiatry, foot care, this is also not covered.
So there's a lot of items that are not covered by Medicare. And kind of like what Mike was mentioning before, Medicare is going to pay for roughly, let's say, 80% of certain services when it comes to Part B. And as Mike also equated to before, when it comes to Part A, if you're in the hospital, you could be paying a good amount of copays or the $1,600, all those different costs if you are in the hospital, because again, Medicare doesn't pay for everything. So what people usually do is they'll get a Medicare supplemental plan, and that'll kind of pick up those holes, those gaps that Medicare has. Now, the supplemental plans, they've been standardized. So if you have Plan G, for example, I'll get into this in a second, regardless of what carrier you have, it's all going to be the same. But everything is processed and everything is national. So if you're in New Jersey, but you're visiting family in Florida or whatnot, and you have a Medicare supplemental policy, they're all national coverage because Medicare is your primary insurance. All of these supplemental policies are doing is just picking up what Medicare does not pay for. Now, there's a variety of different Medicare supplement policies that you can get. What we have found is that most of the individuals that we deal with prefer to go with Plan G as in George. And we're going to show you actually a snapshot of how Plan G as in George actually works. But as you can see, depending on what plan we're looking at, there's certain things that may or may not be covered depending on what plan we're looking at. And the one question we always get asked is, Jeff, Mike, which supplemental carrier is best? I've heard so many great things about AARP. I've heard at Mutual of Omaha, Bankers, Transmit. There's so many companies out there. Which one is the best? And the truth is again, they are all the same. All these insurance companies are doing is just picking up what Medicare does not pay for. Let us show you a quick example. This is a Plan G plan, and regardless of whether I have AARP, United Healthcare, or I have Aetna or Cigna, the benefits are the same. I don't have to see if the doctors are in network or not in network. Everything is getting processed through Medicare. So for example, if I get hospitalized, like Mike mentioned before, my first 60 days, Medicare pays for everything but $1,600, right there in the middle. The supplemental policy picks up that $1,600 so that I paid nothing. Now, same thing with the days 61 through 90. If you remember, oh my God, Jeff, the copay is $400 a day. And remember, like Mike said, there's no cap. So I'm paying this $400 a day if I don't have a supplemental policy, but because I signed up with AARP or I got this supplemental policy through Mike, now the policy pays for it and I am stuck owing nothing. Part B, how Plan G is in George works is Medicare. Again, I have to pay this $226 deductible, so I am responsible for that. Now, once I paid that $226 deductible, like Mike mentioned, Medicare is going to pay for roughly 80% of services, and I would be responsible for 20% without a cap. But because Mike hooked me up with a supplemental policy, Plan G, I owe nothing outside of my annual $226 deductible. So the coverage can be very rich, right? My only out-of-pocket costs are $226. So if I continue to go see my doctor or a specialist, Medicare and my supplemental policy are picking up everything else going forward. Now, while those benefits are rich, and this seems too good to be true, the thorn on the rose has always been the prescription drug coverage. Now, these plans basically, it's a lot different than what you've had in the past, probably working. If you're working for a company, maybe you had one plan through an insurance company, and that insurance company did everything. With Medicare, there's a few different parts. And so we're getting a separate drug policy that's separate from the supplemental policy. Now, depending on what state you live in, there's anywhere from 25 to 30 different plans, and they all have different formularies, different costs for each of the drugs. In 2023, the average cost of a drug plan is $33. Now, there's plans that go all the way up to $80 or $90, and there's plans that cost, $8 or $9 a month. So what our team does is it does an analysis on the drugs that you're on and sees which drug plan is going to be most cost effective for you. Now, again, every drug plan is a little bit different. So just because your friend has had good experience with, an Aetna drug plan doesn't mean that you will, because the formularies are different with every drug plan. And obviously you may be on different drugs. So the prescription drug coverage is something that you want to check every year to make sure that the plan that you're going on into the future year is going to be adequate for you. Like Mike mentioned before, how your Part B premium can vary based on your income. It's the same thing with prescription drug coverage. So I'm going to an insurance carrier, I'm getting a drug plan, and let's say I'm paying that $33 a month, right? That average plan premium. But if my income is too high, Medicare is going to hit me with a penalty. They're going to add a cost onto my plan premium depending on how much money I make. So if I'm an individual filer and I'm making, let's say, $125,000 and I'm in this middle bracket here, I'm going to pay that $33, but then they're going to hit me with another $31 a month penalty. So this is something that, again, you want to make sure that going into it, you know where you're going to fall income wise, so you can know what you're paying for Part B, like Mike mentioned, and then what you're also going to be paying for another premium for your Part D drug coverage. So what's the damage, right? Here again, there's a few different parts. First, we got Part A, which has no cost. Part B, our base premium is $164, but again, that can vary depending on your income. Then we get a supplemental policy so that we're not stuck owing 20% or $1,600 or $400 a day copays. So we get the supplemental policy so that I know that my medical out-of-pocket worst case situation is that Part B deductible of $226. So I get my supplemental policy through Plan G, let's say through AARP, and let's say that costs $175. Then I get my prescription drug coverage, and maybe I get a plan for $23. So my all-in cost is around $362 per month. Now, like Mike mentioned before, my Part B, that $164, maybe it's coming out of my Social Security check if I'm collecting, or maybe they're sending me a bill every quarter. But from a budgeting perspective, I know that I could get my health insurance for $362 and have pretty good coverage, especially on the medical side. Now, when you start looking at your options when it comes to Medicare, you have a few different routes that you can go. On the left side is original Medicare, which is what we just went over, where you're going to get Part A, you're going to get Part B, you're going to get a prescription drug coverage. Maybe it's only $8 a month. Maybe you have to get a better drug coverage that's $50 a month. And then maybe you want to get a supplemental policy. If you go that route, that's original Medicare. And whether you're in New Jersey, California, Pennsylvania, you can see the best doctors, you can go nationally, and you're again using Medicare's network. The other avenue that you can go is going towards Medicare Advantage, Part C. What this does is it combines Part A, Part B, and it's usually going to offer a drug coverage. Now, these policies work a little bit differently, and what I want to warn you on is when you turn 65, if you decide to go down this road on the Medicare Advantage route, and for whatever reason, after a year, 2 years, 3 years, you decide it's not best for you, that you do not like the Medicare Advantage networks because they work more like an HMO. You have to make sure your doctors are in network and everything like that. If you don't like the Medicare Advantage route, in order for you to come back to this other side and get a supplemental policy along with your Part A and Part B, that supplemental insurance carrier, whether it's AARP, Cigna, all of them, they're going to ask you medical questions, and they have the right to refuse giving you coverage based on those medical questions that you answered. So let me repeat that. If you go down the Medicare Advantage world, and at some point in the future, you decide that you don't like it and you want to go back, we have had cases where people have come to us saying, hey, you know what? Someone else sold me a Medicare Advantage plan. I would like to get a supplement and be on original Medicare. Those people have to answer medical questions in order to qualify. We've had people that have, qualified and have had no issues, but we have unfortunately had to have those phone calls where we tell, hey, Jane Smith, unfortunately, AARP denied your application. You have to stay with your current Medicare Advantage policy. We can always reapply in the future, but again, it's something that you want to consider when you're looking at the two routes that you have the opportunity to go down, whether it's original Medicare or the Advantage plan. Now, again, Medicare Advantage, how it works is it's combining all these different parts. It's combining A and B, and maybe again, Joe Namath or whatever celebrity is out there, and they're offering you all of these different incentives. Hey, we're going to pay for your gym membership. Hey, we're going to give you, money towards your hearing aids. Hey, we're going to, pay for your dental cleanings. There's a lot of these different bells and whistles that they're adding on to try to make their Medicare Advantage plans seem more attractive. Now, the Medicare Advantage world, it works a little bit different because instead of you just having that deductible, that Part B deductible, here you're going to have your traditional insurance where you're going to have a higher deductible. You're going to have copays at the doctor's office. So Medicare Advantage, while it may be saving you money on a monthly basis in premiums, those plans are traditionally going to cost you more in copays and out-of-pocket expenses when you do need the insurance. So when we compare these Medicare supplement policies or Medigaps, whatever you want to call them, versus Medicare Advantage or Part C, right, as it's also known as, what are we looking at? Well, again, original Medicare, you have a few different parts. You have Part A, Part B through Medicare, and then you get a supplemental policy through an insurance carrier, and you get a prescription policy through another insurance carrier. Whereas Medicare and Advantage, it's going to combine, everything and kind of put you in a plan that's similar to what you've had your entire life. So which one is right for you? Well, Medigap, right, using original Medicare and getting a supplement, it may have higher premiums on the monthly side, right? So, again, I think it was $370 or $350 that we were all in at. But you're going to have lower or no copays, right? Again, your $226 deductible for Part B, that's your worst case out of pocket when it comes to the medical side. You also have freedom to choose doctors. You can go to New York to see the specialty hospitals. You don't have to worry about referrals. You're covered anywhere in the US. So again, if you want to go see some of the specialists out on the West Coast, or you want to go down south, again, Medicare is a national, national network. So you don't have to worry about where you're at. Whereas Medicare Advantage, again, yes, it's lower premiums, but you're going to have copays. You're going to be restricted to a network. So if you have an Advantage plan through Aetna, that's where you have to see if your doctor is in that network. You may need referrals to go see a specialist. Again, they may have these different bells and whistles, whether it's vision coverage, dental benefits, again, paying for your $20 gym membership, certain things. But if you wanted to go to the West Coast, you may not be covered. You may have to see doctors within your area or within your state. So the Advantage plans are a lot more restricted, but you are paying less per month, in terms of premiums. The way that I look at it personally, if you're 65, if there was ever a time in your life that you wanted to have good insurance and not be restricted, it'd probably be right now, right at age 65. When you're 25 years old, 24 years old, and you don't have much going on, hey, yeah, if you're forced to see that doctor, who cares? But when you're 65, this is the time to have good coverage and be able to see the specialists that you may want to see. So generally, we try to show people that original Medicare might be the best thing. But again, it's not for everybody. There's pros and cons to each. And again, quick overview between the Advantage plans versus the supplement. When it comes to parts A and B that you're getting through the government, Medicare, Medicare Advantage is going to combine everything. Whereas the supplement is really going to supplement. It's going to pick up those parts that Medicare A and B do not pay for, right? It's going to fill in those gaps. There is no network with original Medicare and the supplement. If your doctor or the hospital accepts Medicare, that's it, you're covered. Whereas with Advantage, yeah, you do have to make sure that your doctors and your providers are in network. Referrals are not required with original Medicare and the supplement, but they may be required on your Advantage plans, meaning that you might not be able to see that cardiologist without getting a referral from your primary care doctor. Part D, which is again your prescription side, that is included on your Advantage plans, but it is not included in original Medicare. So that's again another part that we have to get. In terms of monthly premiums, right? Again, original Medicare, we kind of went over it in terms of the damage, right? You're around $350 depending on a month, depending on like what coverage you're getting. Whereas Medicare Advantage, it might be lower, right? It might be $0. And whenever I hear, hey, get health insurance for $0, my ears stand up. Like there's got to be a catch, right? And usually that catch might be a smaller network, or I have to pay more later on. And again, that's where annual out-of-pocket cost with these Advantage plans. Now I might have to owe $7,000 if I'm in the hospital for any reason. Whereas with original Medicare, once I hit that deductible of $226, that's it. I'm covered 100%. So again, when you're comparing these two, you want to see which one is best for you, and that's where Mike or I can kind of walk you through which options we think may be best for you. So we're going to open it up to questions. We want to thank you guys for attending. We hope this was informative. And if you're like most people and you're on this webinar and you're still confused and you're saying, what, Jeff, this has been great, but I think I need help, because every day I go to the mailbox and there's all these different insurance companies, soliciting me, and I'm just not too sure of, where to go. Again, Mike and I are independent brokers. We represent AARP, Cigna, Aetna. We don't have a horse in the race. Mike will help you choose the supplemental policy that's best for you, do that RX analysis for you so that you can be sure that the drug plan that you're going into is the most cost effective for you, not your sister, not your neighbor, or anything like that. You want to find the drug plan that's best suited for you. As I mentioned, we're going to offer you guys the 2023 Guide to Medicare. So a link should be popping up now that you guys can click on to download that. And if you're having any issues, obviously you have our email address. You can reach out to us and we'll send you that copy. If you prefer a printed out version, that's something that we can always mail to you as well. Another link that's going to pop up is a link to our calendar. And this is where we schedule a time either via phone call or Zoom, depending on, what's best for you. And again, there's no cost for it. It's complimentary. We just, again, have a quick phone call or quick Zoom meeting to see how we can help you. If you would like to have Mike facilitate the supplemental policy or whatever it might be, we'd be glad to be that resource for you. But this is where, we've helped hundreds, if not thousands of clients, is that transition onto Medicare, signing up for A and B, holding their hand with choosing the right prescription policy, getting the supplement, everything situated. Medicare is confusing. It's confusing if you do it alone. So that's where, again, as professionals, you're not paying us anything out of pocket. We get compensated by these insurance companies to place the business with them. And so that's something that, again, we can kind of help you with. So again, on the screen is going to come up again, the link to download that guide to Medicare. We look forward to speaking with you over the phone and again, helping you with that transition onto Medicare. So you don't have to worry about paying any penalties or messing it up. Again, that's where we'll be glad to help. Here's our contact information. Otherwise, we will send you the guide, and we look forward to working with you. Everyone have a fantastic day, and we'll talk soon.
Thank you.
Take it easy, guys.